We're joined by Dr. Margaret Harris of the World Health Organization. Good to see you, Dr. Harris. Thanks for joining us. No deliveries of food in Gaza since October, or the beginning of October rather. What are conditions like there?
Absolutely dire, and my colleagues in Gaza can't get in. So we have mounted missions every day in October, and every day they've either been impeded or denied. So we have not been able to get into northern Gaza all of this month. And that means no medical supplies have been getting to hospitals, no fuel, no food, of course, from our colleagues from World Food Programme, no people. We bring in medical teams as well. And in North Gaza, one of the main pediatric hospital, Kamal Adwan, is also a malnutrition centre. We had set up a centre for refeeding of the children who were starving. Now, we can't get in at all to provide supplies, but also there are many children in those hospitals that we would like to evacuate out of North Gaza, but we can't get in.
Can you talk a little bit about how that is, reflected in the communities, how people are responding, of course, to the lack of food? What kind of illnesses and lack of nutrition are you seeing among communities there?
So we'd already seen severe malnutrition, particularly in northern Gaza. It's been on the brink or on the edge for quite some time, and we've seen increasing levels of malnutrition. So in July, for instance, we saw more cases of malnutrition than in children, particularly, than we had seen in the several months before. So now, with this complete blockade, this lack of ability at all to get any help in, when I'm talking about people on the brink, we know that now they will have been pushed into starvation and death. The numbers of children, particularly, who are suffering horrifically are beyond belief.
And there were warnings of imminent famine some months ago in parts of Gaza. The international community put a lot of pressure on the Israeli government in March and April, prompting a series of Israeli concessions around aid access. How much reprieve did that offer? And is that what needs to happen in order to get access for the World Food Programme to bring the food that's needed?
Yes, we are really calling it. We are gravely, gravely concerned, and our Director General has made it clear we are calling on Israel to provide unimpeded access. This is critical, to not put evacuation orders on hospitals. Hospitals are sacrosanct. You don't order hospitals to empty. Hospitals are there to provide care for the sick. But it's critical that humanitarian missions are allowed back into the north. Lives depend on it. We're actually starting a polio campaign next week. The north is the last of the areas that will happen in. But again, we need safe passage. And what we really need, and we've said over and over again, and people treat us as if we're talking about fairyland, but we need a ceasefire. We need peace.
Yeah. And talk a little bit about the prices of food and non-food items. From what I understand, they've skyrocketed since the beginning of the war due to the scarcity and high demand. What kind of economy is there in Gaza to support and pay for this? I mean, how are people buying these items?
So indeed, this is a real problem. And another problem is that there's no system of law and order. So the police for Gaza are not allowed to operate because the occupying power is are the Israelis, and basically the occupying power is the Israeli Defense Forces, and they don't allow the police, the Gazan police, to manage things. So there's great lawlessness, there's great looting. The trucks that come in are at risk, the humanitarian trucks, I mean, are at risk of being looted. It's a very, very dangerous situation. So with so little food, those who've been able to get that food, or who, particularly those who've stolen it, are then demanding very, very high prices.
Right. All right, we'll have to leave it there. Dr. Margaret Harris, I really appreciate your time.
Thank you, Sally.